That was my colleague on the challenges of hospice care in China. Now in Africa, accessing healthcare can be a challenge. My next report tackles Africa's approach to the numerous challenges in the healthcare sector. Africa is confronting the world's most dramatic public health crisis, according to the World Health Organization. With a population of over 1.2 billion people, a large percentage of those living in rural areas have no access to healthcare. The continent suffers from a myriad of healthcare challenges. At the very center of this are financial resources.
The biggest challenge which most African countries are facing comes to financial resources, or resources that go towards the health sector.
In 2001, African Union member states pledged to allocate at least 15% of their budgets to their health sectors. A decade later, while 26 countries had increased their allocations, only one African country had achieved the 15% target.
It's only Rwanda that has actually met this and even surpassed this.
The thinking was that this 15% would be enough to cater towards providing the services, and providing services includes taking care of the human resource component, which is usually hefty or requires a lot of resources from the overall budget, providing supplies and commodities, putting up the actual infrastructure.
The Ebola virus that swept across parts of West Africa exposed the continent's weak healthcare systems. In countries like Guinea and Nigeria, where more resources had been allocated to the health sector, they were more effective in containing the virus. In sharp contrast, countries with almost non-existent healthcare infrastructure were decimated by the virus. According to data from AfriDev Health and Social Development Agency, in 2014, Liberia had 51 doctors to serve the country's 4.2 million people, while Sierra Leone had 136 doctors for a population of 6 million people. Other challenges facing the continent are a lack of infrastructure, lack of adequate trained healthcare personnel, corruption.
We need to clean up our systems to cut down on wastage. Once we minimize the wastage, then we do adequate budgeting, because it would make sense to pump more money into a leaking sieve. If we're able to handle our financial management around healthcare, because that's an immediate need, and it is something that systems are already in place, they just need implementation.
But it's not all doom and gloom. There have been vast improvements. According to the World Health Organization, in 2015, more than 12 million HIV-positive Africans were on antiretrovirals compared to 100,000 in 2003. Of the 42 malaria endemic countries, 33 have adopted artemisinin-based combination therapy, the most effective anti-malarial medicines available today. Most countries are also making good progress on preventable childhood illnesses. Polio is close to eradication, while measles deaths have declined drastically in the last decade. But a lot more still needs to be done. Of the 20 countries with the highest maternity mortality ratios worldwide, 19 are in Africa.
Lack of awareness of how important it is to seek help becomes our first problem. And because that aspect is still failing, it means that primary health care overall then begins to fail. Because primary health care is targeted more towards prevention, towards continued care of chronic illnesses so that they don't complicate. We don't have that aspect in Africa. Is very, very poorly developed.
Then there's the strain on African healthcare systems imposed by the high burden of communicable diseases that could be avoided by meeting basic sanitation needs. It's an increase in non-communicable diseases such as hypertension and coronary heart disease that may prove more worrying. And for all these challenges, more funding, research and training are required. Robert NAGILA, CGTN, Nairobi, Kenya.